Hello everyone, I'm Dr. Jennifer Hibbard, and I want you to know that it was a year ago that I sat right here and told you about a phenomenal effect that ivermectin had in a nursing home here in Toronto, Canada. And over this past year, there have been clinical studies, randomized control studies, and country studies that have shown the simple, amazing effectiveness of ivermectin in the prevention and treatment of COVID-19. I want you to watch this video that I did a year ago and reflect on the fact that this information has been out there for a year now. Welcome to Hibbard Health. I have a great topic that I'm going to share with you today, and it's very important to bring this information forward. It's regarding a new medication called ivermectin, which is actually what is old is new again. This medication has been around for a long time, and there's a lot of studies that have been done on it regarding COVID-19 now, and they're getting phenomenal results, and mortality rate is going down tremendously. And this could be the turning point for COVID-19. We will be talking, Nicole Ziegler, we will be talking about how we have tried to reach out to the media. We've had journalists in touch with us, but they don't seem to be able to bring this forward to the public. And Health Canada is not jumping on it, WHO is not jumping on it, and internationally, all of the studies that are being done are looking quite amazing. So we thought this was a good medium to start the introduction of ivermectin and studies that are going on, so people will start to look into this and bring it forward to the public. Now, Nicole has a very interesting story to tell us about her family, her mother in particular, who was living at a nursing home called Valley View Residence in Toronto, Canada. And they had an outbreak of scabies, and ivermectin was used, which is usually used for parasite treatment of any type of parasites. And it inadvertently has turned into a double-blind study that's phenomenal. So I'd like you to meet Nicole now, because if I keep talking, I'm going to tell the whole story, and this is not my story to tell. This is your story, Nicole. So please, here's Nicole, and please listen carefully to everything she has to say. Thank you. Hi, Nicole. Welcome to Hibbard Health. I want you to tell the story about your experience with the ivermectin and how it inadvertently turned into a double-blind study as COVID-19 started to take over all the nursing homes. So why don't you go ahead and tell us your whole family story?
Okay, so my mother was a resident at Valley View Nursing Home in North York. She's 92 years old. She was residing on the 3rd floor. And in the month of February, they had a scabies outbreak, which is common in nursing homes. And they tried to treat it with a topical cream. And when that didn't work, they just sent out a mass letter to every family that they were going to give a single dose of ivermectin to deal with the scabies outbreak, which obviously we all agreed to because there were no side effects, and that was the way they were going to go about it. And that was in late February. What happened, so you had 170 residents receive this dose, and the 4th floor, which was the one that was experiencing the scabies outbreak, got the highest dose of ivermectin over the other residents, which were given sort of a preventative, I guess, dose. And it was a single pill dose, and it lasts 23 days, actually, I think they said 23 to 30 days it lasts in their system. And that was late February, maybe beginning of March. As it so happens, as we've experienced all over the world, they had a COVID outbreak at the Valley View Nursing Home. But what was unusual with this one is that they had more staff, who of course never took this medication. More staff were infected than residents. And in fact, on the 4th floor, which is the floor that had the scabies outbreak and they received the highest dose, had the most infected staff, and not one single resident was infected with COVID.
And Nicole, how old were most of the residents there?
I would say medium age would be at least 85.
And did they have other illnesses?
And they had chronic, all of them. This is a nursing home. They all have chronic conditions. I mean, some of them are on feeding tubes. Most of them aren't mobile. They have, for sure, a million other, health issues at the same time. And yet not one, and they all receive very close contact care. So most of them need feeding. they definitely need help with, cleaning and washing and dressing. So there's a lot of close personal contact between the PSWs and the residents. And yet not one single resident got COVID on that floor. And in the rest of the residents, there were very few. And in fact, there were only 6 in total. And 4 of them were asymptomatic, including a woman that's almost 100 years old. My mother was another one of the COVID cases. Now, she ended up passing away, but frankly, I think it was more because of neglect and dehydration, because we were allowed access to her the entire time that she was COVID, and she was asymptomatic as far as we could see. All she had was a fever for about a day and a half, a low-grade fever. And but we noticed when I would go in that she was extremely thirsty, and we were only allowed in for small amounts of time each day, one of us only per day. Sometimes not more than 10 or 15 minutes. I could squeeze out on occasion a half an hour. And in every single time we went there, we found her extremely thirsty. She was, which is not like her, because we used to call her a camel, and she never drank. And one of the days, her private caregiver, who had been with her for 5 years, I let her go in instead of me, and she came out saying that she'd never seen my mother that thirsty. So, I mean, my mother's death certificate says COVID is the cause of death. To be honest with you, I saw her for the 12 days that she was COVID positive, and I didn't see any COVID symptoms. I mean, except for dehydration and apathy and lethargic and loss of appetite. That was about all I ever saw from her. And
did you mention too about just, and understandably these caregivers were very fearful to go near the COVID patients
terrified,
too, right? Did
terrified.
You mention you were in there once? And...
Yeah, I was in there once with my mom, and I asked for assistance because she needed help getting in the bed because she was so weak. And most of the PSWs that were there in the COVID time that I was there over the 12 days were not people I recognized. My mom had been there for 6 months. Most of them were from agencies that they sent in. I think there was one that I recognized that had always been there, and she was outstanding, but she was one person. So I remember there was a time that I asked for assistance to help get my mom in the bed, and when the PSW came in, on her way out to get something, she saw my mother's status on her door, and she said to me, "Is your mother COVID?" And I said, "Yes." At that point, we were still waiting for the results, but it was pretty likely. And she left the room and never came back. And when I went out into the nursing area, we were all in full PPE, so it was very difficult to distinguish one person from another. And I had mentioned that I was waiting for a nurse to come back, or a PSW to come back to assist me, and nobody came. And actually I was surprised because she was standing there and I wouldn't have known the difference, and she admitted it was her, and she didn't come back. And I said, "Well, why didn't you come back?" And she just said, "Oh, I work on the other side," which, I mean, it was clear by her reaction. She was terrified and mortified, and I think the media is to blame for that, for the hype. I think a lot of unknown. And so you had a lot of very young, inexperienced, who had no familiarity with the actual residents there, taking care of, in my mother's case, one of the very few COVID patients in the entire nursing home, and people were terrified of her.
Now, you mentioned that you noticed your mother was very weak, but why do you think she was weak? Because you mentioned they took away their walkers, etc.
Oh, yeah.
And
so,
I think that, did you feel that is what contributed
well,
to
definitely it contributed. One of the first days that I went in there, which was only 2 days, they called me on a Tuesday to mention that she had woken up with a low-grade fever. And on the Thursday, they called me in to say that she was passing away and that I should come, and it was just a matter of time. And it was a little bit odd because the day before that, they called me to say her fever broke and everything was fine. So when I went in there, she was pretty okay still. She was very responsive, but she was weak. And I remember thinking back that when I needed the assistance to get her into bed, she didn't seem to know how to walk. And my mother was a very mobile 92-year-old. She was there for dementia, but she was still feeding herself, moving, walking, very, just with a walker. And I'm thinking back, I noticed that the walker was nowhere in her room that I could see. And she was sitting in a chair because they were, from the previous week, they were relegated just to their rooms. They were no longer allowed to get out of their rooms. So I think in the case, most of the patients there weren't mobile. So it really didn't make much of a difference whether they sat in their wheelchair in front of a TV or in the main sort of lobby area. But in my mother's case, she is a walker. So I did notice her walker was missing, or not in plain sight. So making it more difficult for my mother to actually get up and move around. So I think that contributed to her inability. When I asked her to get up, she suddenly didn't know how to walk, and she was walking 3 days before that because I had spoken to her through FaceTime, and she was walking and talking.
Now tell me what happened, because once you made contact with me and Peter Hibbert too,
right?
Tell us the scenario of things that happened, and it looked like it was going to come into the media, but then what happened? We are in Canada too.
Right. So what happened was, I did mention one of the nurses at the nursing home, when I called to check on the status of my mom, had mentioned that they thought this ivermectin had saved their population in the nursing home. And at the time, that was when my mother was sick. I really wasn't paying that much attention because I was obviously sidetracked with other things. But I did ask, well, what are you talking about? And she said, oh, there's a drug called ivermectin, and they all received it. And we think it's saving everybody in here. So at that point, I looked it up, and I saw that there was a study out of the university in Australia that it hadn't been used on patients yet, but they had used it, I think, in the lab, and they noticed that it was killing the COVID virus within 48 hours. So I had mentioned this to a few of my friends because I thought it was, that's okay. I thought it was relevant. So after my mom passed away, a friend of mine had noticed this study that was that had been published, and Dr. Peter Hibbert was mentioned. So she sent me this on an early Sunday morning. She sent me the link, and she said, you have to call this doctor. And I thought, how am I going to get in touch with a doctor in Florida who I have no connection to? Anyways, thank God for Google. I was able to look him up, and I contacted him, and he answered. And I told him what had transpired at this Valley View nursing home, which really piqued his interest because we both realized it was a double-blind study in effect without even trying to be one. It was serendipitously discovered that here we had this perfect study waiting for us. So Peter asked me to contact him by email, and he sent it out to you, his sister, as well as the media. And CTV actually also contacted me, but was unable to actually crack the dome. In other words, they contacted Valley View residents after I had sort of given the administrator a heads up that CTV would be contacting them because of this revelation that there was something special and unique going on here. And while I was speaking to the administrator, she at that point was the first time I had heard that the 4th floor had received this higher dose, which even made this whole thing even more important, really valuable. So when I told CTV, they tried to contact Valley View, and immediately the door was shut. Valley View said that they had no comment and that they would not discuss anything that had happened, and they had no official comment, which shocked me because I really think that we are sitting on something that's huge that could possibly, not only be treatment, but preventative even as well. And nobody wants to talk about it. And I find that's very disturbing.
Well, that's why we're here today too, and just getting some information out there, and hopefully what we're doing today can start to spread around, and just this information can get to different places around the world.
That's what's the real hope.
Yeah, it's unfortunate that even in the States, it's come forward on Newsmax, and it hasn't been picked up. The World Health Organization's not picking up on it. Health Canada is usually the ones that come forward, not individuals on the news. So that may be part of why we're not seeing it come forward in the news directly. But even trying to get in touch with Health Canada and draw attention to this, we don't seem to be getting much of a response. So hopefully very, very soon, because lives are at stake.
Yep. And I think
if this
is
as amazing as it appears to be, it should be analyzed and studied and considered for therapy. And I know they're looking at it in combinations with other drugs too. But the preventive and early treatment is quite phenomenal. And it may take care of that big hump all of us are scared about.
It could get us out of this lockdown, like the way I see it.
Yeah, I agree. Thank you so much for coming.
Thank you.
And this is so interesting. I can't wait for people to hear about all
Me
of
too.
this. It's really
Me
amazing.
too. And I wish that somebody could get in there to actually look at this double-blind study sitting there waiting for everybody to just look at and research.
It's a lot of fear, but of just what would come back to them. But they need to be reassured that, this is a difficult time for everybody and nobody's at blame for anything.
Right.
And this is just valuable information to bring forward. So anyway, thank you
Thank
so
you.
much.
Thank you.
Okay. Thank you for joining me on Hibbert Health. Thank you so much, Nicole, for joining me today. Your information that you brought forward was extremely important, and we hope that it makes a big difference to studies with ivermectin, that this information can come forward and help those who are doing the studies and help it get some airtime and people start to pay attention to ivermectin. And if this really is as amazing as it looks like it is, as I said, this could be a huge turning point for us all. Thank you for joining me. Please subscribe to my YouTube channel, Hibbert Health, and you'll get notification whenever I post another video. And I will be continually putting videos on YouTube to update you on current information and safety information to keep you safe and healthy. Thank you for joining me.